Hi, my name is Danielle Heyman. The topic I have chosen is ineffective communication between nurses and doctors. I chose this topic because I'm interested in becoming a registered nurse. My mother and grandmother worked in the healthcare field with nurses and doctors for 25 years. I grew up listening to stories about patients, doctors, and nurses and their communication with each other. I also job shadowed a nurse in the ER last year. It was pretty cool. The purpose of my speech is to inform you about some important issues and effects the lack of communication causes. The main points I will be talking about are message interpretation, patient care, and the competency needed for the patient's health care. According to the Joint Commission on Patient Safety and Quality Healthcare, Woods states that nearly 60% of medical errors are a direct result of communication breakdown. According to Burns, who wrote an article in Professional Issues, states that time is also a major factor in communication breakdown, because nurses and physicians can be independently busy. Finding time to communicate properly becomes a pressuring issue. Message interpretation is important because the doctor needs to know the care and condition of the patient from the bedside nurse. The communication would improve if the doctor would make rounds with the bedside nurse. Adding a nurse practitioner to make rounds with the physician, then reporting to the staff nurse, will better the communication of the physician and nurses. If there is ineffective communication with the nurses and doctors, the patient will not receive the proper care they need. For example, patients are sometimes given the wrong test, medication errors occur when medicines are ordered to the wrong patient, and doctors not returning an urgent call that is needed when a patient is critical. Patients don't like waiting for their discharge instructions. The doctor has to write them, therefore the patient is waiting for the doctor. The competency needed for the patient's health care is not being given if there is no communication between the nurses and doctors. The competency for the patient would include test results, concerns or changes with the patient, and keeping members of the team up to date with what is happening with the patient. The nurse and doctor have to be competent in order to take care of their patient. If this is not being done, the patient is not receiving high quality and safe patient care. A tool to improve this would be the use of SBAR, which stands for Situation, Background, Assessment, and Recommendation. This is a guideline to be used on each patient from each member of the team. For example, situation. Dr. Brown, I'm calling about Mr. Jones, who's having trouble breathing. Background. He's a 50-year-old man with a chronic lung disease who is sliding downhill ever since he has been admitted. Assessment. I don't hear any breathing sounds in his right chest. Recommendation. I need you to see him right now. I think he needs a chest tube. The nurse is providing a clinical information the doctor needs in this situation. Nurses and doctors have a high responsibility to improve communication problems. It is a virtue for the safety and well-being of their patient and the team involved in the patient's care. The three topics I discussed are essential to provide safe and effective care for the patients. If I choose this career field, this will help me in my future to be a good nurse, communicate well with the doctors, and give my patients the best care that I can. Thank you.